Okay, up next, we're going to hear from Tim, Donna and Oliver, who are our crack team working on the innovation collaborative between NHSX and the AHSN network. If you guys want to come on the screen and start, and if anyone else can turn the cameras off, that'd be great.
Thanks, Laura. Much appreciated. I think it's me first, so if we could go next slide. And I guess just to be really clear before I introduce myself, we're doing a bit of the work. The real work is the stuff that Roma and colleagues in the regions are all doing. So I wouldn't want to try and take credit for that incredibly hard work. And I guess from my point of view, and my name's Tim Cullinan. Hi, everyone. I'm the head of delivery in the NHSX digital health team. It's just a huge thank you. I think some of the work that's been described there around challenges overcome in difficult circumstances is really inspirational, so it's much appreciated. I'm just going to a couple of very quick minutes just to talk about our programme going forward into next year. And what we're really looking to do as we move into next year is build on the good work. So there's been loads of sort of hard yards gained, lots of really good progress, and we're really keen to sort of learn and share that progress. And Donna will talk more about that in the Innovation Collaborative. And I guess the other bit we really want to continue to build on as we move into next year, and it's come up a couple of times in the chat, is really around our sort of engagement and making sure that what we're looking at fits really well for local patient needs, fits well for local clinicians, and also carers and people involved in these services. So just to briefly go over our areas, as we move into next year, we're going to have 4 main areas of focus. They're virtual wards, which we've talked about a lot. There's also long-term conditions, and just to be really clear, it's so important that we focus on this as an area. So the virtual wards is really important. It's an area where people would otherwise be in a hospital bed, but we know that supporting people either in the community or their usual place of care with their long-term condition is a really key part of our service going forward in all NHS services. So it's not to say that the community managed element isn't important. It's extremely important. It just has a slightly different focus in terms of virtual wards. Care sector is also a key element for us as we move forward, and we've heard some really good examples, as is mental health as well. And in those 4 areas, some of the benefits that we're trying to look at, and these are kind of, I guess, a bit health service driven benefits to an extent, but we know there's really positive patient stories and clinical stories that sit behind them. So we know that in terms of clinical time saving, some of the work with ECGs in the North East and Yorkshire already saved 70 weeks of clinical time, which is fantastic. We've seen A&E reductions of around 20% in some of our care home work in the Mid and South Essex, which again, brilliant work. We've seen non-elective admissions reduced by around 13% in Hampshire. So again, huge work. And our virtual ward work in NNUH in Norfolk has seen an average reduction of around 7 days. So getting people home out of hospital a whole week earlier, which is absolutely fantastic. So yeah, I guess that was all I want to say really. 4 main areas next year. We've got some benefit areas. We want to learn on what we've done, and we want to say a huge thank you for all that mega hard work this year. So it's much appreciated. Thank you. I'll pass to Donna next.
Thank you, Tim. Good morning, everyone. I'm Donna Clements, and I work in the digital health team at NHSX, and I've got a focus on shared learning and improvement. So we've heard some great examples this morning of how technology-enabled care and remote monitoring can make a real difference to people's lives. But as we know, some of this technology isn't new. But over the last 18 months, we've seen a real rapid increase in how we use the technology and different uses across pathways. And as Tim Ferris mentioned this morning, this is a real opportunity to do things differently. So it's so important that we share the learning and the different ways of using this technology that can support care away from hospital settings, keeping people where they feel comfortable and safe, i.e. at home, as we've heard through the great examples today. So as you've heard, the Innovation Collaborative is all about sharing opportunities, the challenges, the successes and the learning, so that project teams and frontline staff are not starting with a blank sheet of paper, and they're really gaining the experience and knowledge from other teams who have been there, done that, got the t-shirt. So we'll work together as the Innovation Collaborative to share the impact of technology-enabled care, and to really build a library of evidence-based resources that can be used across the health and care systems, and people moving towards digital models of care. So as you've seen through the chat this morning, we have a lot of resources that are shared on our Innovation Collaborative Workspace, which is hosted on the Future NHS Collaboration platform. And our workspace currently has over 1,200 members, which is rising, which is wonderful. And those are members from health and care sector, academia, voluntary and third sector, as well as digital innovators. We have over 500 shared learning resources on that workspace, which have been downloaded or viewed over 7,000 times. And given this workspace is a little over a year old, we think that's pretty impressive. So the majority of resources on the workspace relate to the focus areas we've heard about this morning, but there's also resources on there that support the role of digital in elective recovery, as well as signposting to other resources for digital health and care. We have resources that include case studies, podcasts, videos that share experiences from staff and patients and service users. So really get that impact across, and those human stories are so important, as well as the quantitative benefits. We've got resources on there to support people working through benefits management. We have recordings on masterclasses and thought leadership events, which include human-centered design in healthcare and inclusive digital transformation. So there's a real range of really useful resources. We will be uploading the recording from this event, and equally we have recordings from previous Innovation Collaborative events if you want to learn about other spotlights from regions that we've talked about. And really importantly, we've got locally developed resources, such as you've heard from today, such as standard operating procedures, DPIAs, onboarding guidance, example of posters that could be used with patients. And we're really, really keen to share that learning from local teams so that you learn from each other. And we're also really keen to explore some of the different improvement methodologies that people are using so that we can share those as well, appreciating that one size doesn't always fit everybody. So if you want to know more, if you want to learn from others, or you want to share local resources and knowledge that you have, please get in touch with us. We'll drop into the chat once again about how to join the workspace. The workspace is only as good as the people who actually can contribute to it. So please help us to get this shared learning across the system, because then we can make a real difference. Okay, that's it from me, and over to Oliver. Thank you.
Thanks, Donna. Thanks, Tim. I'm Oliver Barnes, and I'm the Programme Director for the Innovation Collaborative for Health Innovation Manchester and the Academic Health Science Network. And I'm going to talk to you about how we're going to continue to make a difference through this next phase of the collaborative to June 2022 in generating insights and sharing learning and best practice. So what is that offer? What is that support? And what are the resources that are going to be available? So through a benefits side of things, we have specialist benefits coaches that have been assigned to each ICS who are delivering tech-enabled remote monitoring projects. 39 integrated care systems are being supported to date, with up to 4 days on average of bespoke benefit support. We're going to continue to build change and deepen the evidence base through rapid evaluations, collaborating with clinicians, specialist nurses, tech partners to support vulnerable and at-risk groups in the community. Continuing to tell the story as well through people, process and cultures, and that will entail 2 national events, one of which we're on today, 5 more podcasts, 7 more case studies, a comms toolkit, an animation, 4 more videos, 7 more specialist workshops, and 6 tailored newsletters. And just to reiterate, all these resources will be available on Futures, in addition to the ones that Donna has gone through, and we encourage you to utilise them. They're there to be used and shared and support your learning and implementation.